started. Welcome to the Health Hub with Dr. T. I'm Dr. T. Today we are speaking on a very, very, very important yet valuable topic, which is ABA therapy and autism. I have so many questions. I didn't even have to Google questions because I have so many questions of my own that I want to
Mm-hmm.
ask and just get some background information on. And so I just want you to introduce yourself, your
Yeah.
background, where you're working, and then we'll get right to it.
Yeah. So I'm Kea Lee. I'm a board certified behavior analyst, also known as a BCBA. I've been in this field for about 8 years now, and I've worked with children as young as 18 months up to adults that are, my oldest adult at that time was 46 years old. I've
Wow.
done center based services, in home, telehealth. I've also done some work for the city here. I live in Virginia Beach. So I've done some work for the city, and that's where I worked with adults.
Okay.
And currently, I'm still working in a center, but I do dual. So I'm in a center, but I also serve those in home as well.
Oh, perfect. So, I mean, most of you know, and those that don't know, I am a physical therapist. So I
Okay.
treat pediatrics and geriatrics. I prefer my geriatrics, but
Okay.
I'm in an outpatient setting,
Mm-hmm.
so I get whoever comes through the door. But we do service a huge population of pediatrics. I even treat patients at ABA centers,
Okay.
and then we have those that come into the clinic for OT and speech. But I want to go basic. So I know the foundation, right? But a lot
Mm-hmm.
of people do not know the foundation. So I want to go as far back as what is ABA, right? I
Yeah.
want to start with the foundation of what ABA is, because from there, we can kind of build the conversation, get
Mm-hmm.
more into questions, get more into treatments, assessments, and so forth. I know prior to, I'll give a little bit of a foundation from what I know. So please
Yeah.
correct me if I am wrong.
Okay.
I know for most patients or families that may suspect that their child or loved one may have autism, the first step that is really recommended is for them to get a psychological evaluation through a psychologist.
Mm-hmm.
With that being said, the psychologist does a very thorough assessment and is able to give that official diagnosis.
Yes.
I say that to say a lot of people think that their PCP can give the diagnosis, but
Mm-hmm.
from what I have seen, I don't believe a PCP can single-handedly give that diagnosis. That's why they always refer to a psychologist to get the assessment and to actually get that assessment. I mean, get that diagnosis. Is that how it works over at Virginia Beach, or it should be the same? Is that
Yeah.
your
And
experience?
yeah, in general, it's the same because, like you said, a PCP typically doesn't diagnose. They just
Yes.
recommend and they usually refer out to a clinical psychologist or developmental pediatrics as well, and then to do the official testing to get diagnosed.
Okay. So I know that once they get that diagnosis, there's a
Hmm.
lot of information. There's a
Yeah.
lot of questions. There's a lot of so much that they get thrown into, right?
Hmm.
I think if I can recall, I meant to read a psychological assessment today, but Mondays are my busiest days
Oh,
and
yeah.
my life days. Go figure.
All in one.
But they throw so much at the parents, right? They're like, we recommend 40 hours of ABA. We recommend PT, OT, speech, nutrition. Like,
Hmm.
it's so much all at once. And I get parents that are like, I don't even know where to start.
Yeah.
And a lot of them start at ABA. So from your point of view, what is ABA, and what should parents expect when they hear the clinical psychologist or the developmental psychologist say, I want you to get ABA services?
Yeah, so ABA is a scientific, evidence based practice where we use just a bunch of different interventions to analyze behavior, to understand behavior, and to ultimately just help change behaviors. Whatever behavior is most important to the family, and what benefits the child, long term for their life. I think ABA has a negative rep just over the years of being very strict, or people tend to think, like I said, they think it's very strict. They think that
Right.
the kids have to like sit at a table all day just to learn, and it's only like one way by like the child only listening to the therapist, and there's no like teamwork involved with the family. But I think that was just an older way that ABA was implemented, like when it first became about years ago, but it is evolving and growing. And one thing that I like to teach parents, because that's a question that I get a lot, especially when I'm doing those initial assessments. Parents are scared because they have done a Google search and
Yeah.
they read so many negative things and negative comments about ABA, but there is good in ABA, and ABA is good. And I try to let them know that we go with the child. It's really child led. So the kids are learning through play, and through play we're working on, communication skills, behavior reduction, like decreasing those behaviors that may be um like detrimental to the child's health or well-being, and then increasing other skills that are important to that child or person. It does have to be a child, because ABA can be
Right.
applied to anybody, not just children. It's just behavior. And even I think too, ABA is um, like everybody always connects ABA and autism together, but
Right.
ABA is solely a science that just changes behaviors, and it could be
Hmm.
applied to anything: sports, health, even interventions like for yourself as a parent, or as an individual as well.
Wow. So I didn't think about that. And I've never heard anyone put it like that, where,
Hmm.
you really just think it's for the patients, right?
Hmm.
But it's almost like, okay, the patient goes home. What happens when they go home, right?
Hmm.
The reason why they're coming to ABA therapy is to learn these techniques and so forth. So it's almost like the parents also need a little bit of ABA therapy
Hmm.
so
Hmm.
that they know how to carry over. I'm gonna try not to get clinical. Try not to
Yeah.
carry it over into the home. Okay, give us a rundown as to what should happen at an ABA center. I've been to a few different ABA centers.
Okay.
There's some that I'm like, and then there's
Cringing.
some that I'm like, oh my gosh, But
Hmm.
what should well let's go back. How many hours typically is recommended for ABA? How many
Hmm.
hours should be recommended for ABA? And then give us a rundown of what a day to day looks like at an ABA center.
Yeah. Okay. So if you're referring to like an ABA center, it really depends on the child and what the family can realistically manage. Like I wouldn't prescribe a 30-hour week if I know that a family can only commit to X amount of hours, even though it may benefit the child to have more hours. But if realistically we know, like, okay, the family is working, they can't really get to therapy, they can only commit to 10 hours a week, then we'll commit to that. But it really just depends on the severity of the child, the behaviors, the skills that we're looking to work on, like those long-term aspects of treatment. And then, so what ABA for me looks like, even in a center, is that the kids are happy, the kids are playful, and there's not a lot of sitting at a desk. Like if we're sitting at a table, maybe it's because we really need our child to focus on a specific task. If it's like fine motor skills and we need to work on something with a pencil, we don't want to do that like running around, because
Right.
obviously that doesn't make sense. But if it makes sense for them to be at a table to and they need that focus, then that's fine. Or you're playing an interactive game with a peer. But it really should look like the child should be happy and you're teaching through play.
Okay.
Yeah.
So do they do the typical like circle? Because let me be honest, some people say ABA therapy is almost like a glorified daycare,
Hmm.
where it's like, oh, I just feel like, I'm dropping my kid off at daycare and I'm gone. Is it the same? Is it similar? Is it different? What makes ABA different from a typical daycare? Nothing wrong with daycare,
Yeah.
nothing wrong with ABA, but what is the difference?
So one difference is, of course, having that one-on-one therapist. Every child is always assigned one-to-one throughout their day. And if a child is at an ABA center for an extended day, you should be working on different things throughout the day. So if a goal is to work on communication, by saying hi to people, like going in different areas of the center, like working on that social communication to speak with other people, and then maybe moving on to if they need to work on their fine motor skills, then working on that through block building, through using like lacing cards, or grasping things with their fingers. So it's best in best practice, I always try to implement schedules. So, we're going to have during this time, go ahead and work on social skills goals, but not specific to like, okay, you need to do this specific one, but social skills in general. How can we interact with people throughout the day? So just being strategic and planning out their day can really help, especially even guide the technicians on what they should be doing out throughout the day based on the child's treatment plan, so that it does not feel like daycare. And then also holding our parents accountable and
Mm.
also teaching them. So if our parents are not set up for success in the beginning, they're going to have the expectation of, okay, I'm dropping my child off at ABA and it feels like daycare. But if they don't understand and know that we're all working as a team to really build your child's skills, and that no, this is therapy, and the same things that we're doing at home you have to also implement, I mean doing at the center, you have to
Right.
also implement at home, and then guiding them and following up with them. So really building, like I said, that team work framework, and then involving the parents a lot so that they understand and they too know that it's not a daycare and it is a therapy.
Yes, I think a lot of education goes into it, a lot, and constant, right?
Mm-hmm.
Because we can all get into a rhythm of the drop off, pick up, and then
Yeah.
it's almost like no, there's more to it. There's
Mm-hmm.
actually, family education, much more, which we'll get to. So let's say you get a new parent whose child was recently diagnosed with autism, and they are, told go to ABA. What are some key things? Because I think people can give tours of different ABAs, just like how
Mm-hmm.
I did tours for daycares for my child. I would
Yeah.
think that I should be able to do a tour for different ABAs. What are some key things that a parent should look for when they tour the ABA to say, yes, I feel comfortable with my child being here or my loved one being here?
Okay, so one thing I would say is really look out for the therapist interactions, because of us, we clinicians can tell you all the great things about the center, but really getting in there and just observing the interactions that the therapists are having with the children. How do the children seem? Like, do they seem like they're having fun? Are they smiling? Are they engaging with the toys? Really looking at those things, and then how the environment is set up. Are there a lot of like closed rooms? Is there open spaces? I mean, obviously we can't um like some centers, they work with what they have, like if they,
Right.
depending on the space that they have purchased. So just seeing how they have equipped that space. Do they have a lot enough like sensory toys? Do they have, how are their bathrooms set up, and how do they keep like the privacy of others? So just paying attention to the environment as a whole, and not solely going based off of what the BCBA says as
Right.
well.
And I think that's important because, like I said, I've been to a few ABA centers, and
Mm-hmm.
just as we know, autism is a spectrum,
Yeah.
and you have those that are on the, I would say, do I call them the lower end of the spectrum, where they're not as aggressive, and maybe they're able to follow commands but not able to communicate. And then you have some that are really really aggressive, right?
Mm-hmm.
And it's, you walk into a center sometimes and you see, a child maybe, banging his head against the wall or
Mm-hmm.
something like that. As a parent, that could be really, really scary, right? That could be
Yeah.
like, oh my gosh, is this what ABA therapy is about? My child doesn't do that. So does that mean that my child being here now will be aggressive? So
Mm-hmm.
how, as a BCBA, would you, I guess, give the parent hope to, explain to them that yes, this is what you're seeing, but it's also a spectrum, and these are measures that are put in place. How would you
Yeah.
address it when a parent is super scared of that, which is
Yeah.
valid?
It is. And I've actually had that specific example
Wow.
happen. It's so interesting. I'm like, oh my gosh, that has happened. But I remember to like emphasize, like you said, like every child or every person just responds to things in their environment very differently, how they express their emotions. If you see someone headbanging, it could be that child is trying to regulate and they don't know how. So to regulate, they feel the best to, hit their head against the wall. But we are just knowing that that is why that child is here, and we're trying to help them through that, to better communicate, emotions or things that are going on, but also letting the parent know that kids can like imitate or copy behaviors wherever they go.
Yes.
Like they could
Yeah.
they could see someone doing something at a store or when they go to school or just anywhere. So not letting that be the sole like decision as to why you don't want to send your child to ABA, because you can put them in a daycare or, like I said, anywhere else. You can go to the park, and if they see other kids having behavior like yelling at their parents or just anything, they can easily pick up those too. Or even from like family members, if you have cousins
Right.
over your house,
Yes.
kids can pick up all types of behaviors in any environment. So I wouldn't want a parent to just exclude and not like jump on an opportunity for their child to receive therapy because of that fear.
Right. And I mean,
Yeah.
that's a good point because you can't, I think it's always how you manage a situation and not necessarily the situation happening,
Yeah.
because it's not like, it's at that moment you're like, oh my goodness, like you got to show this, we have a new parent, but that's the reality of things.
Hmm.
But it's how you all do, I guess, address the situation. So as a BCBA, are you one-on-one with your patients, or do you have a team that work with your patients?
Yeah, so whether it's center based or in home services, I am just a supervisor. So
Okay.
as a BCBA, we'll do the intake and we will come in and supervise depending on what that child's insurance authorizes for, we'll come in and do like supervision. I feel like with center based, it's a lot of hands on as
Mhm.
well, because you can constantly see the kids, every day, even though you're not technically supervising that particular kid, you get more face to face with them, and you'll see them and see the technician and help them throughout their day, whereas in home you have to be a little bit more strategic in
Mhm.
visiting everyone's home, depending on like your caseload size as well, to make sure you can see everybody.
Okay. I want to give a little shout out plug to like RBTs and
Oh
BTs.
my,
Can
yes.
you talk a little bit about them? Because I'm like, they yes, I'm gonna. If you're, I mean, I know a couple of RBTs,
Hmm.
I know a couple of BTs. I work really closely with them, and I am super, super, super like amazed by the work that they do. How well? Explain what an RBT and a BT is. Then explain the work relationship between a BCBA and a RBT and a BCBA and a BT.
Okay, so a BT is a behavior technician. They maybe have had the training from their workplace that have provided some like basic foundation training. But the RBT is a credential through the board, that they have a 40-hour training, specific training, and then they go ahead and take a exam to get the RBT credential. So the RBT which is a registered behavior technician. I'm sorry, and then
Okay.
they get the credential for that. The working relationship between technician and BCBA is, like I said, the BCBA kind of leads the way and shows technicians how to implement certain interventions, answers questions, models. For me as a supervisor, I always try to teach technicians in the best way that they learn. So if I notice a technician needs more like modeling, like I need to do it first, show them how to interact with the child, show them how to implement a certain program, then I'm going to do that way for them. Or if some technicians are like, no, I'm hands on, I need to do it. Can you talk me through it? And I
Right.
will do that as well. So just, knowing that, how they learn, and then that's kind of how like the working relationship is between BCBA and technician. But they are really like hardworking individuals. I mean, I was an RBT at once
Oh, I was gonna
as
ask
well.
that. Do you have to be an RBT to to become a BCBA?
Hmm. Well, most people take that route because you're in school and then you're accruing hours. So most of the time a lot of people get into the ABA field and then they're a BT or RBT and then they collect the hours, but you have to be in school in your
Right.
master's program to be able to collect the hours to sit for the board exam. But yes, I was RBT as well. I was an RBT for 2 years. So you and I always tell my technicians, like, you are like the heart and soul of this, and I really depend on my technicians because they are the ones that are there like day in and day out dealing with not dealing with handling behaviors and managing behaviors the most. And I, just come in every so often, especially when it's that in-home client, and try to support them as best as I can. But yeah, RBTs, they are, I don't know where we would be without them, because us as BCBAs, we couldn't do it on our own, honestly, without our technicians.
Absolutely. I just, hi, Dr. Johnson. This is on my TikTok family who found me on IG. So, well, welcome. And he does a lot of subject matter expert conversations too. So it's good
Okay.
to see him in this space. But yes, because y'all, RBTs get bit, they get scratched, they get like, and they're quick. Like, before I could be like duck, and RBTs be like, no, you're not gonna do, like, they step in. I feel like they're like the police. They're just, they are like ready. And like, they come in and they're just, and I think to be an RBT, you have to love it. You have to love these
Hmm.
kids because I see just the way they interact with the kids. I see the way they, pamper them. One of them was like snotty nose, and she wiped her down. I mean, it's just they're with the child for a long period of time, right?
Hmm.
So, but it is just amazing. I don't know if this is an ABA thing or a BCBA thing. The pairing of a patient and an RBT has got to be important. Like, has to be a
Hmm.
skill, right?
Hmm.
Because how do you know that this child will do best with this RBT? Are there
Hmm.
times where it doesn't work out? Are there times where you're like, this is absolutely, you're a trigger for each other, so this is not working? Do you have those situations?
Yes, that happens. I mean, just like any individual, you're just not going to always pair,
Yeah.
well with certain people. And I had that, instance with a parent who felt like their technician wasn't a good fit for their child, and the parent was very open. They were saying like, "Hey, like, I don't think that he or she, I can't remember if it was a male or female at the time, but I do remember it was a female. He was saying, I don't think that she's a bad RBT, but I just think that she is not the right fit for my child. And then, I have those conversations with the technicians as well, and, still uplifting them, knowing that, letting them know that you are a great RBT, but maybe there's a different skill set that we're looking for with this, specific child. And that's okay. Um, too. So yeah, that definitely does happen.
It
But the
has to be. Go ahead.
Oh, sorry. No, I was just going to touch on how you said the building that relationship pairing with the client is very important too. And I emphasize that a lot in the beginning, especially like maybe during the first month to almost 2 months. Some people may think that's long, but in my opinion, I don't think so, because our clients are like, you're nobody to them. They don't know they don't know you, they don't trust you. So to really build trust over time, we have to take the time to really get in their world, like really get down with them, learn what they like, learn what they don't like. And that takes time for one person to learn like a whole life of another individual. Because I have had parents ask or comment on like technicians, and they'll see like, oh, they're just playing, you're not really doing therapy. And I'm like, they are really doing therapy, but it's through play, through building that rapport.
Right.
Because you don't want someone just coming in and trying to instruct your child and your child not trust them, because it's hard to really receive information from someone that you don't trust.
Right.
And that's even us, like as an adult, if I don't trust someone, I'm not really going to want to open up and
Absolutely.
receive information and receive teaching from you. So that's why I too really agree that it's very important in the beginning to build that trust and to build that foundation, especially like through play.
And I think that's why we're having these conversations, right? Because someone can't, it's almost like even therapy, PTOT speech,
Hmm.
and we're on the floor and we're building blocks or whatever the case may be. And someone's like, no, this is not, you just, she could be doing this at home. And I'm like,
Hmm.
I know, but it's different,
It
right?
is.
But that's where this comes in. That's where this information and this knowledge gets shared to people so that
Mm-hmm.
they understand from the outside looking in, it may look like this, but it has to look like this in order
Yeah.
to reach the results that we want to, right? Because
Mm-hmm.
yes, I love the RBTs that I work with. I try to get my kiddos on a like playing outside on the swing
Mm-hmm.
set, and they really follow through after me because I only see my patients 1 or 2 times a week. That's not
Mm-hmm.
enough. But the
Yeah.
RBTs are like, oh, what are you looking at? Why do you do that? Okay, we're gonna try that too. And I love that because that's repetition, right? And you
Mm-hmm.
need that repetition, and the child needs to be comfortable. So I'm
Yeah.
glad that you said that.
Yeah, it's really important. And like I said, I think it's just a piece that a lot of people miss or skip over. And because of also pressure from parents, they're like, okay, well, we just need to go ahead and start these interventions. But it's like, no, let's just hold on a second.
Yeah. Let's get to know each. It's almost like you're courting, right? Let's get to know each other, and then once the RBT or the BT and the patient know each other or the client, it gets better. Like the
Mm-hmm.
outcomes becomes better. Someone in the chat said, unlike daycare, an ABA center is also very data driven due to the
Mm-hmm.
one-to-one system. They
Yeah.
track a lot of things, which helps parents better understand how milestones are being reached.
Yes,
Yes,
absolutely.
100%. But that's also with the parents that are involved and are willing to learn. Have you come across any parent that really treats the ABA as a daycare and
Mm-hmm.
not, are not, I don't want to say invested in their child because I don't want to use that word, but where they're
Yeah.
not as involved, I would say.
hmm I've had a parent or few like that. And what I try to do is really just try to understand the parent. Like,
Yeah.
how do they even see ABA? Like, how do they see themselves as a parent? And this one specific parent that I'm thinking about, honestly, she did treat ABA like a daycare, and because she was just tired. Like, her child had a lot of high intense behavior, so she felt like this was a relief. And then parent training to her or parent meetings were just like another task. She didn't see it
Mhm.
as like help or assistance or a learning opportunity. So once, like, as a BCBA, I try to empathize as much as I can. Once I understood her a little more and just listen, like through a lot of our parent meetings, I would just listen and she would vent and vent and vent. And I would address like what I could from a BCBA standpoint. I
Right.
built that rapport with her over time and let her know that, because she also felt judged for a lot of decisions that she
Mhm.
made. So letting our parents know that this is a judgment free zone. I am here to really help you, and I want the best for you as a parent. That's what I want. I want the best for the
Right.
parent, and I want the best for your child in the long run. So setting up those like thoughts in the parent's mind, I think over time helps them then want to learn from you. So just like we pair and we build rapport with the child, we have to do the same with the parent. And we're not just there to tell them, okay, you need to implement this intervention, you need to work on this at home, you need to do better with X, Y, and Z. Like, no, we need to first understand our parents and understand their perspective, because they too have a learning history. They were brought up one way, and maybe they feel like they should be treating their child or trying to parent their child the same way that they were, and they notice it's not working, and now they're frustrated.
Right.
And helping them build those connections with their child and understanding their child. So first, really just, I know I'm going on a tangent, but just
No,
really
no, no.
understanding,
Yeah.
helping the parent really, helping as a clinician, I'm sorry, helping to understand the parent a little bit better, and then, building that rapport with them as well. So they
Okay.
can trust you.
Yeah, absolutely. I want to go back. I probably should have asked this first.
Okay.
What made you be a BCBA? And I'm asking that because you're super, super passionate about this.
I am.
And you're all about, like, even when you guys, shout out to social media because we met on threads.
I
Like,
know, right?
first week I was on threads. I met a psychologist. I've met Kea here. So we've met, but even from the moment I told you what I was trying to do and
hmm
these lives that I do, I could feel it. Like I could feel your passion. So what made you want to be a BCBA or
Yeah.
RBT and BCBA?
Yeah, so my undergraduate degree is in speech language pathology. So I was going down the road to be SLP. But one thing, I've always loved working with kids. Like my first job when I was 16, I always said I never wanted to work in a restaurant. I never wanted to do like retail. I wanted to work with kids. So I've, coached gymnastics. I did summer camp counselor, all of that. I've always loved children. But once I didn't move forward with SLP, I was a private school preschool teacher, and through that is when I found ABA. I knew nothing about ABA, and I had a child in my class who was receiving ABA therapy, and their behaviors were changing, and it really like intrigued me. I'm like, oh my gosh, like I don't understand like how they're helping this child like not cry about X, Y, and Z, or just regulate their emotions. So I just dove a little deeper to learn more about it, and then immediately I applied and got into a grad program, and immediately I switched to be a RBT right away, and then I just dove in deep, and I really do love it. I just love learning about like children with autism. They're just children in general amaze me, like their thought process, how
Yeah.
they view the world, and then children with autism, they just view it so differently, and it just really intrigues me to understand like how they perceive the world, what they're thinking, what they're trying to communicate. And I just really want to help more people just understand those that have autism, and know that their voices are very loud. They have big emotions and big opinions
Yes.
and just big thoughts about things. And yeah, I do. I just love it. I love
Yes.
parenting. I love ABA.
Put them together. You're like, that's where I'm
Yes.
at. And
Yes.
it's so funny you said that because I think that a lot about my patients, and I'm super, super like motherly to my patients with autism. Even though I'm
Hmm.
also stern, I'm that therapist
Yeah,
that I'm
you.
like, and we're gonna talk about that next. But
Hmm.
I feel like I always wonder what they're thinking because I'm like,
Yeah.
they're so smart and they're
Hmm.
so like they problem solve, or they're so good with math. At least my patients, right?
Hmm.
And I'm just so intrigued as to like, what are they thinking right now? Like I always want to like know. But that brings me to my next part where I want to talk about a child being,
Hmm.
let's say, client A is a 4-year-old boy, right?
Hmm.
Um, a 4-year-old boy with autism and a 4-year-old boy without autism.
Hmm.
Not comparing, but looking
Yeah.
at what point do you say that is not autism, that is you being a boy,
Hmm.
right? That is not, because they're still children, and
Yes,
they're
they are.
still. Look, my pediatrician, I can say this because my pediatrician said it. She said, "Do not negotiate with terrorists. Your child, your kids are terrorists, right?" So to me, I'm like, and I'm super stern with my patients, but they love me and I'm able to get
Hmm.
results. But I'm like, it's because I'm very disciplined with them. So at
Hmm.
what point do you tell parents like, oh yes, your child or someone that has autism doesn't mean you just give them the world? Do you still implement structure? Do you still implement
Hmm.
discipline? Do they still get in trouble? Like, what does that look like? Are there repercussions for their actions, or do they just
Hmm.
get away with everything?
So no, I definitely don't let tell my parents that they can get away with anything and everything, because I always let them know like at the end of the day, they're going to be adults. Whether they are with you until, the end of time, or you want them to be able to live independently, or whatever their future may look like, they are still going to be adults who have to know the rules of society regardless. And so what I try to tell them is, don't give them everything, but set up boundaries based on what they can handle. So one 4-year old may be able to handle like very strict, boundaries, but another one may not be able to handle all of that just yet, but build them up in increments depending on like their skill, their understanding, their ways of communication. So very, tailoring it to your child, but still holding certain boundaries, certain standards, because you still have to live in a world that has rules, that has
Absolutely.
standards that we all, even though we don't like it, we have to abide by.
Right. Us as
Yeah.
adults, we have rules that we don't like. So
Yes.
I strongly believe in discipline, whether with autism, without autism, because especially with clients with autism because I've seen it. I've seen that they understand, and I see
Mm-hmm.
that they also they love the structure of it,
Yeah.
right? And I think one of the obstacles that I run into with parents is just like, oh no, I just give him everything, or I just tell her it's okay, and I just, she, throws a tantrum, and I'm just like, okay, 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 fine, and I'm like,
Mm-hmm.
yeah, they're registering that, right? They're like, oh,
Yeah.
every time I throw a tantrum, I'm gonna
Mm-hmm.
get what I want. And I was at an ABA center one day, and the RBT, like the boy got upset at something, I don't know what, and he
Okay.
literally got the chair, like a little kid's chair, and was going to hit it on the RBT's head.
Mm-hmm.
And she turned around and said, "Don't you dare." And
Mm-hmm.
looked him, and he kindly put it down,
Mm-hmm.
smiled, and then proceeded to just walk away. And
Mm-hmm.
she was like, because I don't play like she I was like, oh my God, is this child, is this 88? But she was like, he knows with me, I don't play that. With other
Mm-hmm.
people, maybe he gets away with that. And so they were, obviously talking about it because the RBCs all get together. I'd be like, what they talking about?
Yeah, right.
Um,
Yeah.
but because I like a good tea and good gist. But one of them talked about it was like, yes, he does that with a specific RBT because he
Yeah.
knows he could get away with it. But then, like,
Mm-hmm.
he tried it with this one, and she was like, "Not today,
Mm-hmm.
bro." And he
Mm-hmm.
literally calmed himself down and said, "This is not happening." So
Yeah.
it's interesting.
It is interesting because, like you said, they're still children at the end of the day. A lot of them do understand more than I think we give them the credit for
Yes,
understanding. And it's just knowing, and even it's just knowing like what your child understands. Cause like in that moment, she knew like, okay, he knows that he is not supposed to throw a chair, but he's just going to push the boundaries just as any
yes,
child or any person is going to do. But as
right.
long as like we set up those boundaries, we set up the expectations and then continue to teach them through that, they know and understand.
They know, and just like any
They
child, they're
do.
gonna test
Hmm.
you.
Yeah, they
So
are.
are there classes in ABA? So for example, a child comes in, and you'll see where I'm going with this question. A
Okay.
child comes in beginning of 2025, right? Been in ABA for a year. And is the child supposed to stay in the same level of when they've come in? Are there different classes? Do they advance? Do they progress? Or is it almost like, we just continue working in the same, how do I explain it? In the same like team that I've been working with? Or
Hmm.
am I to say, okay, you know what, you've been here a year, you're now
Hmm.
able to do X, Y, and Z. You now move into this class or this category of patients or clients. Is there
Hmm.
such a thing like that?
No,
Okay.
and not from what I've experienced. No, there's no like class. It's like, okay, we do our treatment plans based on a 6 month authorization. Some
Right.
insurances will let you do a year, but most of them are 6 months. And within that 6 months, we have like fading criteria, discharge criteria specific to that client. And then they have their treatment goals as well. And so, and that's what us as supervisors come in and do where, analyzing the data, seeing how they're making progress. What can we do if they're not making progress with certain things? But like you said, like with a client that maybe has been there for a year and they need to continue receiving services, we just analyze their progress over time. So if they're not reaching the goals that we have set forth, okay, maybe we need to change something on our end on how we're teaching. Maybe we're not teaching to the learners um like teaching them where they are. Like maybe we need to
Right.
change what we're doing, or maybe they just still need more time because ABA and behavior, it takes time.
Mhm.
So it just depends. There's no like you said, there's no tier, there's no class. You just continue forth or discontinue depending on the progress that your client has made with the goals that are set forth. And you just keep reevaluating.
Right. Because at what point well, let me ask this. Can a client test out of ABA?
Yeah, well, test out. Well, yeah, they can like,
Like
I would
make
say like
enough progress to
master
say
out
that
their goals.
yeah.
Yeah,
Okay.
most definitely. Like I've had a client that I felt like we've reached like their full potential
Hmm.
with ABA. And sometimes even though that our clients like stop ABA, there may be other therapies that may better suit them for that time period of their, life or whatever it is, whatever other goals that they're trying to achieve or their family wants to achieve. So yes, they some have definitely mastered out of ABA. Also, if they are in a like a EIBI, so an early intervention clinic, if
Hmm.
they are eight, they're about to, if the clinic ends at 6 and you're going on 7, they kind of age out of that center because they can only serve them at that early intervention stage. Then they may move on to another center. I know everywhere does it a little bit differently, but yeah, they can like master out. But what I've told parents before, because I've had a few clients that have like mastered out of our services, they're scared. They're like, okay, well, what if like we regress or what if we need it again? I'm like, you can always come back. It's not okay.
Hmm.
It's not like how school is. Like once you're done with fifth grade, you're done with fifth grade forever. Like
Right,
you
right.
don't go back. But ABA, you can always go back because behavior is ever evolving. It's ever
Mhm.
changing. And with different life stages, there may be new behaviors coming about. Like if a child's going into their teenage years, or you have a teenage girl who now is more emotional or now has their menstrual cycle and trying to understand that, or wanting to drive, or going into adulthood and now you want to learn how to get a job, how to write a resume, and dealing with behaviors that may surround that. So people are ever growing. So even though you may master out at one level, you can always come back and continue to
Right.
work on different skills.
Okay, it's good to know. I have two clients that kind of transitioned into school. They
Mm-hmm.
tested one half, half a day or a half a week at school, and then transitioned into full time. But at what point would you say that, okay, this client has been here for X amount of years, right?
Mm-hmm.
We're really not seeing progress. Um, Maybe it's the ABA Center, maybe
Mm-hmm.
it's the BCBA, maybe it's the RBT. Do you recommend changing centers
Mm-hmm.
and trying out? There's a difference between changing centers and then like center hopping. Cause
Yeah.
I know some parents that they're quick to be like, in 3 weeks, nothing's changing. 3 weeks, we're going, but knowing the difference between what is the difference between center hopping
Mm-hmm.
and actually changing centers, right? Because to me,
Yeah.
that I've seen a lot of center hopping, and I
Okay.
want people to be knowledgeable as to not to do that.
Yeah, I actually have not come into contact with many families at Center Hub, so that's interesting. But there's all kind of people and situations that happen.
Yep.
So, but in my mind, I guess center hopping, like you said, would be just changing too often to see the change, and because you're not seeing the change, you just want to switch, but not sitting and really investing the time and learning into that. But on the other end of that, like if we've had a child there for, like you said, 3 years and they're not making progress, then and I've too had this happen before. The progress was just a little slower, or it just was taking longer than any of us like really expected. You never know how long it's going to take for a child to make progress, so I never put
Right.
a time stamp on it. But if I feel like by analyzing all the data, seeing what I can do on my end, are the parents doing their part at home, do we need different technicians, like seeing all those different you know aspects of therapy. Do we have enough material that is appropriate for this child? Are we providing them with enough learning opportunities? Are they coming here enough? So just like all of these different
Right.
factors I'm going to look at. But then at the end of that, if I'm like, okay, well, I feel like we really aren't serving our client the best, then that's time for that conversation with the parent and say, not that I don't think that your child is, you know, not making progress, but we're not seeing the progress that maybe you want, or we're just not a good fit for your child anymore. Because sometimes it can become routine when kids are coming to ABA day
Yep.
in and day out at the same center, seeing the same people, the same toys, being in that same environment all day, every day. It can become sort of like mundane. It's just like routine. That can also halt progress as well. I've seen that. So yeah, just recommending like, okay, well, you should still go to a center, but maybe let's try a different center, and then provide them with those recommendations as well for a little bit of change. Because sometimes we need a little bit of change in our
Yep.
lives, and we kind of get bored and we're doing the same thing and we don't see progress in ourselves because our environment is the same. So just simply changing the environment, you can sometimes see growth.
Agreed. I think I have conflicting, I guess, thoughts when it comes
Hmm.
to some ABA.
Yeah.
I didn't realize how much I would be such a big advocate for in-home ABA.
Hmm.
I think sometimes for those that have been in an ABA center, you can walk. I don't have autism, and I walked into a center and I'm overly stimulated.
Oh yeah. So it
And
can be
I'm there to help
overstimulated.
you regulate, and I'm there to, like, I can't even focus. I'm nosy. I'm looking left. I'm looking right. I'm like, what is going on? Is it okay? Do I need to call 911?
Yeah.
I feel like sometimes it's a lot, and these
Hmm.
clients are already overly stimulated. Like, why do we want to put them in an environment that is even more overly stimulated?
Yeah.
Right. So I advocate for in home because I'm like, I want them to have the socialization,
Hmm.
but I need them to understand the foundation first before
Hmm.
now opening. I mean, is that a wrong way of thinking about it? Like,
Hmm.
help me, because let me not be giving the wrong advice to people.
No, I don't think it's a wrong way. I just think so for me, I like both. It really just depends on the child. Like
Yeah.
sometimes we need to get the child away from the parents because the
Mhm.
excuse me, the child is so like clingy to the parents, or it's just
Yeah.
really hard to like break that like
Yes.
just same mode of thinking, same patterns to in order to see the behavior change in the home because they're already used to doing routines a certain way. So first it's good to like get them out, get them in the center, really build that rapport versus some children it is better to start out in home where they feel most comfortable, where we really can work on those goals in the home versus the center. Because like you said, it could be overstimulating or they have like separation anxiety. So now then if we take them in the center, now we're working with trying to help them with the separation anxiety and then still building behavior. So then now we're kind of uh putting ourselves like against ourselves versus
Right.
like trying to help the child. So for me, it really just depends on what's best for the family and what's most suitable for the child and what the parents can really commit to as
Right.
well to
I
build
mean,
that consistency.
yeah, I agree. If I know there's a dad, there's a parent, there's a family that I'm trying to get in home. It's so where the client has done like horrible at every ABA center, but
Mm-hmm.
he comes into our clinic and he is like amazing. He's
Yeah.
at home. He's amazing, but he goes into any ABA center, and around them are the bigger ones. So maybe it's
Okay.
just too much for him,
It
and
could
then
be.
aggression that he's never had all of a sudden is coming out, right? So then
Mm-hmm.
parents keep pulling him, putting him somewhere else, and at this point they're like, you know what? When he's not in school, he's just home with them. So I'm
Mm-hmm.
advocating for like in-home ABA because I'm like this happens, or this he could benefit from it. So
Yeah.
I like your points. Your points are very valid.
Ah!
I'm gonna listen to your points, and I'm going to. It has to be. It can work. There are pros and cons to
Hmm.
everything. Yeah,
And it
pros and
could
cons.
even be like, because you brought up a good point too, like if they're like surrounded by the big corporate ABA centers, it could be the type of center, like
Yeah,
maybe going to a smaller family owned or BCBA owned clinic
right,
versus the corporate ones because they're going to look and feel a little differently. Like sometimes I feel like I've worked for both. I worked for big corporate ABA centers, and I've also worked for smaller owned BCBA clinics. And I can say that the corporate ones they have all the materials, everything that you can
right,
think of, they're really supported, but also the BCBA owned ones, it's the feel is sometimes a little more homey.
right.
They get that more like close knit feeling, and that could also be beneficial to some children versus the big center with all the bells and whistles on it, because some kids don't need all of that, they just need to feel safe and loved and in a
Absolutely.
smaller environment.
Absolutely. And nothing against the big centers, right?
Oh no, not at
The big
all.
centers are great too. But
Mm-hmm.
like to piggyback on what you're saying is, sometimes look past that and look at how your child is doing. And to me, it's
Mm-hmm.
all about progress. I mean, I'm a PT. I assess, I treat, I reassess. I treat, I reassess, right? So it's
Mm-hmm.
almost like you don't have to make big leaps, but there should be something.
Mm-hmm.
And if there isn't anything, it's like, you know. Um, I have a girlfriend who has a son with autism, and we were talking about progressions. We're talking about
Okay.
changes, and we're talking about the little wins. And
Mm-hmm.
I want you to kind of talk a little bit from a BCBA standpoint, what those wins look like. Because for some of us, we may think the win is, they are fully potty trained in 3 days.
Yes, that's a big one.
I don't even a child without autism. I don't know how that works, but that's a big leap. But then for our kiddos with autism, their wins look different. And
Mm-hmm.
how do you have parents understand that their wins are wins? It just isn't maybe a big leap, but all these little steps really turn into a big one, right? So, well, how
Mm-hmm.
would you address that with a parent who's like, my child isn't making any progress, and why are we here? And where do you come in
Mm-hmm.
and advocate for that child, or
Yeah,
how?
so
Where?
well, I just like I said, it's always individual. So
Yeah.
it brings me back to this like one child who he was doing had a really hard time like in school. Like he wouldn't walk in. They would have to come pick him up all the time because of behavior.
Mm,
So in that specific example, like little wins for me would be okay, is he walking in? Like, is he happy just coming into our building, just walking up to the threshold? That's a win right there because you already know that he wants to be here. He feels safe.
yeah.
He's eager. He's excited. So a little win could look like that. Another little win could be, is your child like interacting with with his therapist? Some kids, it really takes a long time for them to interact, to lean in, to
Yes.
hand you an item because usually like, no, this is mine, I don't want to play with
Yes.
you.
No
So are
sharing.
they right, are they sharing with their therapist, and is that carrying over at home? Are they sharing with their siblings? Are they allowing their siblings like in their space if
Mhm.
before they weren't? So just paying attention to the little ways that your child is growing, whether it could be like, oh, they didn't pay their parents any mind. Because I've had that example before, like, oh, my kids, I'm non-existent to them. But now is your child like leaning into you? Is your child just standing next to you and being
Yeah.
there for X amount of time? So really just paying attention to those small things that your child kind of didn't do before, and seeing those as wins and as progress. Because once you start to see those, like you said, it's a build up over time. And then you'll see those really big leaps that you really want, whether it's communication or maybe potty training down the road, social skills, things of that nature.
Absolutely. I mean, it's. I think even for anyone, it's the little wins that
Mm-hmm.
kind of goes a long way. But looking at that and seeing that, and you didn't have a tantrum today, or you didn't
Mm-hmm.
have a behavior, you were able to regulate yourself better, or
Yeah.
instead of it being 7 minutes, it took us 5 minutes this time around. I
Mm-hmm.
think kind of really, really goes a long way. Oh my
Yes.
goodness, this has been good.
Yes. Yes.
You were like, I don't know what to expect. I don't know you.
Oh
What you
yeah, I
go?
was like, what you gonna ask for? I'm here.
You're here and you are doing amazing. What are some? I know I'm in Texas. I'm in Houston,
Okay.
and I know you're in Virginia Beach, right? And
Yes, I'm actually
so,
looking to move to Texas soon. So my to Dallas though, not
oh,
Houston, but
oh my goodness. You come to Houston eventually.
okay.
You'll get a taste of Houston and you'll be like, you know what? I'm
Mhm.
gonna go to Houston. I'm gonna go to
Okay.
Houston. Don't worry. I'm waiting for you. I'm gonna keep in contact with you and be like, remember I said on my
Yes.
live, you're moving to Houston, you're gonna move to
Okay.
Houston. But what are some resources that you feel parents, whether new or seasoned? Oh, look at Dallas in
Somebody
the
said
chat.
Dallas.
See, don't get them started. Lies, lies. Don't get them started. It's Houston. Don't let them confuse you, kid. Don't let them
Okay.
confuse you. What are some resources that you feel kind of helps a child with autism overall, right?
Hmm.
It's a community.
Yeah.
It's a community. So how do you advocate for your kiddos? How do you say, make sure you're doing this, you're in that, all of those things in order to bring the best out of them?
Yeah, so I would say from a for a parent to really show them that it would be just through the data, like because are collecting data on a lot of different skills throughout their day, and really showing them the progress, like helping them to see the graphs. Like I show the graphs, I explain like what we're tracking, how we reach mastery criteria, what that looks like through examples. I asked if I could take videos of their kid throughout the
Mhm.
session with with their consent only for them to see, so they
Right.
can see that progress throughout session. So just advocating that way by really showing them, because you could tell parents like, oh, you should do this at home, you should do that. And they're like, okay, why? Like, you know, why does that matter? Why is that important? So really like helping them to understand. And then also on the parent side, I really advocate for parents to look into their local like Facebook groups
Yeah.
for other parents that have kids with autism, for someone to lean on, because I don't know everything, and I don't try to act like I know everything. I'm still constantly learning, and I don't fully know the experience that a parent with a child that has autism is. Like I have two young children myself, but they do not have autism. So that parent lifestyle is looks very different day to day.
Right.
So really getting in those types of communities to have those others, people to lean on. I've also had like parents build relationships with other clients in the center naturally,
Right.
not me like forcing it or anything like
Right.
that, but
Right.
they see each other at drop off, so they'll build like those relationship with parents, other parents as well. And I feel like that is one of the like biggest resources for parents. And then like I said, as the clinician, just helping them every step of the way and really showing them and empathizing as best as I possibly can.
Yeah, I mean, I agree. I agree. I think resources, there's so many. I mean, the statistics last time I checked was like one in every six, right?
Mm-hmm.
So now there's so many groups, there's so many resources. I am very familiar with and I don't know if they're nationwide. They're Autism Speaks.
Mm-hmm.
They help kiddos on the spectrum find jobs, so
Yeah.
many things. They do galas. They're
Mm-hmm.
very big on the independence part of it.
Mm-hmm.
So I think that goes a long way, is being resourceful, being knowledgeable, and just
Yeah.
getting as much information as possible.
Mm-hmm.
What do you think about children on the spectrum, excuse me, and sports? I get asked that
Mm-hmm.
a lot. Is can I put them in swimming? Can I put them in
Mm-hmm.
karate? Can I do, what would be your response to that?
Yeah, so depending on the child and what they can like handle, what they can tolerate as far as being around like other children and following like those rules. And those are like the skills that we, even work on, like following instructions, imitating others. Can you do what like your coach is doing? Or just even finding those like I know here we have like the Special Olympics. I'm not for sure. I don't know if that's like a nationwide thing, but it's for any child with special needs, not just autism, to participate
Right.
in different sports as well. But I encourage parents to do all of the things that you would do as if, even if your child, has autism or not, they should still be exposed to sports, to social skills groups as well. I wouldn't ever want a parent to feel like they have to limit their child because of those
Absolutely.
things. Yeah.
Absolutely, absolutely. I think this is a very, very sensitive conversation, right?
Mm-hmm.
And it is very, but I think it's a conversation that needs to be had. And I
Yeah.
think a lot of parents that I've heard or have spoken to me have, received this diagnosis of their child or children, and it's almost like they don't even understand. They're almost like a machine. It's like, okay, they say ABA, PT, OT, speech, and I just sign them up for OT, I sign up for PT, I sign up for ABA, and that's it. And it's like there is more to it, and I think it's up to us as clinicians to educate, to bring
Mm-hmm.
awareness, and to continue the conversation, because not everyone knows everything. Not everyone is in healthcare and
Yeah.
understands all that comes with it.
Yeah. And I think yeah, just like you said, helping our parents and guiding them like as best that we can based off of our knowledge is, really beneficial to them.
Yeah. So what anything, I don't know if anyone had any questions. I think people are just taking it all in, which has been, I think, really good. And I think you've done an amazing job of just breaking down expectations, and breaking down what ABA is, because I
Mm-hmm.
wouldn't lie, when I before I even entered treating patients with autism, I had to go in and try to understand what is ABA therapy, right? I
Mm-hmm.
had to go in and try to say, okay, these are techniques that I'm learning from the BCBA and from the RBT on how to maximize, my patients' day when they're with me, their treatment styles, and maybe I am being too stern and maybe that doesn't work, and maybe I need to be here, or
Mm-hmm.
if they have a tantrum, or if they have a behavior, or if they have, because there are tantrums and there's behaviors I see with some of my
Mm-hmm.
patients. Some of them I'm like, nope, 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 you know exactly what you're doing, so you're throwing a tantrum. And then there's some that I'm like, no, this is a behavior because you really don't understand how
Mm-hmm.
to regulate your feelings, so
Yeah.
you've done a great job of kind of breaking it down.
Yeah.
Someone said, if we wanted to go the route of becoming a BCBA, would you suggest getting the hours needed at a smaller clinic or at a larger clinic? Oh, that's a good one.
So, I think it depends on what the clinic can offer you. I got my hours at a smaller clinic where I was able to like be like the lead technician very quick. I didn't have to go through a lot of like standard protocols that the bigger companies tend to have, like you have to go through tiers and you have to do like these certain
Mhm.
things. Like every company is very different, so I would kind of like company shop so to say and see what they have to offer as far as like accruing hours, what opportunities are there for you to get out like your indirect hours faster, because now the board when I was becoming a BCBA, it was like 50-50, but now it's 60-40 as far as like you have to have more indirect hours. And as a technician, you're going to have more direct hours because you're directly working with the client. So really seeing how many indirect hours that aren't directly with your client can your company provide for you, because
Mhm.
that determines how long it's going to take for you to accrue those hours. Could be longer depending on what they can offer you. And is it paid or is it unpaid? That's important too.
Because if I'm an RBT and I better be getting paid,
Yeah, for
I
these
better be getting
hours.
paid if I'm getting bid on. Look, it needs to be a win-win. But I think it makes sense, right? It depends on small companies can be a lot better. Like a mom and pop can go a long way, right?
Mm-hmm.
All right.
Mm-hmm.
Someone said, how long do you typically have a child for? Like a client.
Well, if you're referring to like hours per week, that really just depends on the severity, what skills we're going to address, the time commitment that the parents can commit to. So it depends on those factors. And then as far as like years, I never really put a deadline. Like I don't say, okay, in 1 year or in 2 years we'll be done with services. I take it 6 months at a time. Typically I see children longer than 6 months unless they like move to, like if their parents are in the military and they have to move. That's like really rare, but it really just reevaluating the children every 6 months, and we just keep going from there and seeing what kind of progress they're making.
Okay. I mean, I think that's fair. And like we
Yeah.
discussed earlier, I don't know if she was in earlier, is, if you're still not seeing, progress or anything, change may not necessarily be bad. Not saying
Hmm.
you just yank them out and take them somewhere else, but
Yeah.
maybe a change of scenery might be more beneficial
Hmm.
for them. Someone said, just to encourage parents with kiddos on the spectrum, an autism diagnosis is not the end of the world. It's a hard gig, but continue to keep progression in mind. The
Hmm.
seemingly little wins matter. I'm reading these out because when I upload this live, it doesn't show the comments. And
Oh
I
man.
think
Okay.
these, I know, I don't know why I thought IG loved me and would kind of transcribe it for me. I thought we were all AI, but we're not. So I repeat the questions because I want those that are watching after on YouTube to be able
Yeah.
to, because they have similar questions, and
Mhm.
for encouragement like this, because I think it goes a long way. Which courses did you find more difficult, and do you have any tips on how to get through the courses?
Okay, so are these like your
BCBA,
mass
going into BCBA.
going into your BCBA, your master
Yeah.
courses? So, which course did I find most difficult? To me, I would say, what was that course called? Oh gosh. See, now I'm like, what are the courses
You like when it's hard, you're supposed to remember. No, I'm
I
joking.
know, right? You're like, oh, when it came to learning the graphs and how, like the different graphs and what graphs to use, experimental design, that's what it was
There
called.
you
So
go.
I feel like that one, my gosh, what was that called so long ago? That one was the trickiest for me, and to get through that course, I'm a visual learner. So even though I'm hearing someone teach it to me, I would write out things like over and over and over. And then and drawing the graphs and like putting them the pictures up so I can memorize the graphs as well. That would say would be I would say it was the most like difficult course for me during that time.
I
But I
think
actually ended up
it's
loving it too.
I think kudos to those that I mean anyone that wants to work in pediatrics. I work in pediatrics because I have to. No, I'm joking. Really, not joking. But I think when I see people like this person wanting to be a BCBA and wanting to invest in children's future, I think it goes a long way. And I really thank you for the work that you do. I thank you for showing up every day because it's not easy. The
No.
parents get it, but you guys get it too because you're with some of your kiddos for 40 hours a week. You're
Mm-hmm.
there, you're helping them with breakfast, lunch, sometimes a late snack,
Mm-hmm.
potty training. Oh, I see it. And it's a lot. But we thank you well on behalf of the Health Hub with Dr. T, and I'm sure a lot of parents out there. We thank you for the work that you do, the investment
Yes.
that you put into every child. And I think that goes a long way. If someone were to
Thank
have a
you.
question from this live and say, I just love Kea Lee, I resonate with her, I was able to just connect with her, how can people reach out to you? Do you have your own practice? Do you do virtual? Because I know some people
Mhm.
do ABA virtual. Do you do virtual? Or if it's a mom or a dad watching this and saying, you know what, I want to know, is my child in the right ABA? Am I making the right steps? Am I
Mhm.
moving in the right direction? And I just need to hear somebody that has no connection to me and I just want to reach out to you. Can
Yeah.
they do that? And how can they do that?
Most definitely. I've had parents reach out to me through my Instagram page. That's where I get the most interactions with people, which is at moment of underscore behavior. Also on Facebook, Moment of Behavior LLC, and the same for TikTok. People can reach out. I do off through Moment of Behavior is where I offer like virtual parent coaching services. So it's
Okay.
not specifically ABA because I do not do the direct work. But if parents need advice on behaviors and how to manage those, or if they're not ready to get jump right into ABA and they have further questions, I provide like behavior consultation for that as well. Or if they're like on a wait list to get their child diagnosed and they have concerns about behaviors and they don't know how to manage behaviors or trying to understand, I can assist with that as well virtually.
Awesome. Well, I think that's great. I didn't even see that. I
Yeah.
think that's great. I knew your Instagram handle, so I was like, pretty sure she's doing something. But it's good to know that you're available for a consultation and you're available
Mm-hmm.
to just, or even to be like, hey, no shade towards my BCBA or anything like this, but this is what I'm being told. Almost like an unofficial second opinion. In a
Mm-hmm.
way, it's like, just what are your thoughts? This is your
Mm-hmm.
area of expertise. Or if
Yeah.
someone is trying to be a BCBA and they're like,
Mm-hmm.
this is what I'm trying to do, but I have these questions, they can reach out to you.
Yes, most definitely. Because I like my goal is like I know I'm only one person, but I really want to change the thought of ABA, like people's mindset on it, and just know that at the end of the day, we're just trying to really help
Yeah.
change behavior and understand behavior, and
Yes.
just changing that perspective.
Absolutely. And with more conversations like this and more, I mean, this has been great. This has been better than I even imagined. And I think these conversations need to happen a lot. more,
I agree.
and
Yeah.
and just as often as possible, because you don't know who's listening at what point, and
Mm-hmm.
you don't know who's ready.
Yeah.
Sometimes someone, they're going through it and they can't hear it yet, but as
Mm-hmm.
long as we continue to talk about it, eventually they'll be able to hear it. So thank you.
Yeah.
Any last words, any tips, any word of advice, anything that you think I've missed out, I haven't touched on, that you feel would be
Mm-hmm.
beneficial to the community, to parents, to healthcare providers like myself?
Mm-hmm.
Any tips or last words you have?
So the one thing I would just say, because I could say a lot of different things, but the one thing I'll always say is just to, when you see, and just anybody, when you see behaviors or when you see children having behaviors, whether they're young,
Mm,
whether they're old, just know that they're not bad. I think a
mm,
lot of time, just over time, we put, like, if a child is not acting right, quote unquote, or the way we want them, or the way we think, or society thinks they should act, we attribute that behavior to being bad. But just
mm,
know that, if you see a parent and a child with a child and they're having a hard time, don't judge them. You don't know like what's going on with them. Empathize, don't stare.
mm.
Just try to remember that some kids have a harder time with certain things, and just know that behaviors aren't bad, and that there's always a reason as to why someone is behaving a certain way.
Wow. What I'm hearing you say is be kind and give
Hmm.
grace.
Yes, grace. That's the word right there.
Give
Grace.
grace, because yeah, it can be. And I think the parents already feel that they're being watched, and they
Yes,
feel
and
like,
judged.
yeah, yeah. And it's kind of like, how as a society can we get to the point where we either step in and be like, what you need, girl,
Hmm.
while you're taking care of that, let me finish with your groceries, right?
Hmm.
Or just kind of protecting each other, at least, because not only is the child trying to regulate their behavior, but the parents are also trying to, I guess, understand how to handle these behaviors. And I
Hmm.
think it comes out at the worst times. It'd be like
Yeah.
at church or in the middle of the grocery store, and it's like,
Yeah.
you
You
were
like, you
just
were
fine
just
5 minutes.
fine. Look,
You were
you were just
doing
fine.
your issue 2 minutes ago. But now it's like this candy wrapper is green and you want it red, and
Hmm.
everyone is losing their minds. So I hear you say give grace. And I
Yes.
think that goes a long way for kids without autism, kids with autism,
Hmm.
adults, everyone just,
Everyone.
life is already hard. Let's give grace to
Yeah.
each other.
Yes,
Thank you so
ma'am.
much, Kea
No,
Lee.
thank
Thank
you for
you.
having me. I appreciate you.
So will you be back if I invite you again?
Absolutely. I
Yes,
will.
yes, 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 yes. I have bigger plans for next year. I actually want to put together an autism conference next year
Okay.
and have literally all the spectrums and everyone coming together. And just again, it's all about knowledge, it's all about information, all about
Yeah.
resources, and just getting as much knowledge out there as possible.
Hmm.
So I thank you
Yeah.
all so, so much. As you know, you guys, we have a conference next week. Our
Okay.
very first one is virtual and in person. And all information is on my page. So please, if you haven't registered, register for it. We do have a psychologist that is going to touch on autism and ADHD. So I'm seeing that combo
Hmm.
quite a bit in a lot of our clients at the clinic. And so
Yeah.
she's a clinical psychologist that is going to speak about autism and ADHD together, separate. What does that look like? How to address it, treatments, and so forth. And then we have financial literacy, we have nutrition, managing your blood pressure and blood sugar, and we have CPA talking about taxes. We have it all. So it's going to be a great, great conference. April 18, 10 a.m. to 2 p.m. Central Time, virtual and in person. If you haven't registered, please register. If you need sponsorship and you're like, I am not paying $25, let me know. We have sponsorships that would cover your tickets. So on that note, thank you so much, Keely. I can't say thank you enough.
Oh, goodness.
You've done an amazing, amazing job. So I said thank you for all the great information.
Oh, yes.
It was definitely needed. You might be getting some people in your inbox just asking questions,
Yeah.
but I appreciate your time. I appreciate your time, and I appreciate your time because
Yes. Well,
time
I appreciate yours.
is absolutely good. Thank you, everyone, for joining the Health Hub with Dr. T. As you know, all information heard on this live and on this platform, general information only. If you have specific questions for your loved ones or for yourself, please reach out to your healthcare provider, reach out to our speaker here, or reach out to anyone that is specialized in this field. Thank you all so much. Have a blessed week. Have a fruitful
Yes.
week. Protection and love to you all. Thank you for joining. Thank you, Kea
Thank
Lee.
you.
I'm giving
Yes.
you a virtual hug.
Right. There you
Thank
go.
you. Have a
Thank
blessed evening. I know it's
you.
past your
You
bedtime.
too.
Thank
Oh,
you
yeah.
so.
What's up?
Thank you so much. Have a good night, everyone.
You too.
Bye.
Bye.